Thank you so much, Lexi. I'm excited to be here. And let me get ready to share my screen and we will jump right in. Candida is one of the biggest things that I see in practice. We're going to start from the basics and build on that. And we're going to talk a lot about Candida overgrowth in the gut, in the GI tract. And then also we can get Candida overgrowth in other areas of the body. So we'll go into that a little bit as well. This is just a disclaimer, just reminding you that this presentation is just intended for educational purposes and not for medical advice. So let's just start again with basics of what is Candida. So Candida is a naturally occurring fungus that grows in our bodies, especially in the gut. In fact, if you look at studies using jejunal aspirates, in healthy individuals, it typically shows that there are low levels of Candida. So this is really a part of a healthy microbiome. We find Candida in not only in the gut, we find it in the mouth, in the throat, on the skin. We find it also in the vaginal cavity. That can all be, again, part of this sort of normal ecosystem. It becomes problematic when the Candida gets overgrown, right? And so that can be known as a term called candidiasis. So if you hear that term, that just means Candida overgrowth. And that can lead to symptoms. We'll go into more symptoms in just a bit, but that leads to things like bloating, GI discomfort, skin rashes, maybe frequent vaginal yeast infections, thrush, chronic fatigue, things like that. Now, when Candida becomes overgrown, it's generally because there is something, some type, the environment has become right for it to become overgrown. It could be an immune system issue. It could be something like low stomach acid, hypochlorhydria. It could be diet related. It could be that maybe we're consuming a diet high in sugar, processed food, maybe excess alcohol. All things like that can cause naturally occurring Candida in the body to become overgrown. So, what we as practitioners, as root cause practitioners, want to do is, of course, get to the root of the problem. What is actually causing this Candida to become overgrown? Again, we want to look at diet and we want to look at a few other underlying causes that I'm going to mention in just a minute to talk about and think about when we're working with clients. What has made this person susceptible to this overgrowth? So, some reasons that Candida can become overgrown, especially in the GI tract, dysbiosis is very common. When we have dysbiosis, that basically just means an imbalance or an unbalance between good and bad bacteria. When that happens, the environment becomes right for this Candida to become overgrown. And again, candidiasis is just that term that refers to Candida overgrowth when it becomes more opportunistic and overgrows. So, some reasons for this dysbiosis or this imbalance, it could be things like medications. It could be frequent or recurrent antibiotic use. It could be steroids. It could also be proton pump inhibitors. By lowering the acid in the stomach, you're creating more of an environment for pathogens like Candida to become overgrown. It could be an autoimmune disorder. It could be someone who has a weakened immune system or who's immunocompromised. So think of things like patients with HIV, patients who are on chemotherapy. It could be diabetes. We do know that Candida overgrowth is more common in the diabetic population. And then there are also, of course, some lifestyle reasons for dysbiosis. One is eating that diet that's high in refined carbs and sugar, maybe excess alcohol as well. The standard American diet, when we're eating more processed foods that are, again, high in sugar, that sugar is just going to feed this Candida, especially if it starts to become overgrown and then we're continuing to consume foods that are high in sugar, excess carbs, and alcohol. That's just going to continue to cause it to grow and multiply. Also, stress. I think that's something that we cannot discount. Stress weakens the immune system. So then you have more of that environment that is right for Candida to become overgrown. And so now let's look at what are some signs and symptoms that you might see in your patients that would cue you in to think, okay, maybe this person has Candida. and then we'll talk about what type of testing you might want to have the patient undergo. But some signs and symptoms. So I mentioned a few of these earlier, but yeast infections. A lot of times you're going to see women who are coming in with frequent or recurrent yeast infections. Candida can affect not only the mucosa, it can also go into the tissues. But when we think mucosa, not only do we think GI tract, we should also be thinking the vaginal. It's actually estimated that 1 in 5 women have Candida in their vaginal tract without having any symptoms. So it's pretty common that, you're going to find it there. And again, we need to think, what are the conditions that have maybe caused this to become overgrown? So you may see patients, women who are coming in saying they keep having these recurrent vaginal yeast infections. That is known as, can be termed vulvovaginal candidiasis. And then GI issues. So we'll focus a little bit more on GI issues here, but some of the symptoms that you might see in your patients with Candida, bloating is almost always going to be there. That's going to be one of the number one symptoms that you're going to see. So when you have Candida and there is this excess overgrowth, basically Candida starts this fermentation process in the gut, and it produces gases, and then that's what causes the bloating. So again, pretty common there. Abdominal pain, maybe just cramping, discomfort. You might see constipation, or you might see diarrhea, or you could even see a mixed picture of both. So think more of like your IBS type patients. You can see also increased gut permeability for sure. And then there are some studies that show that an overgrowth of Candida is associated more with gastric ulcers and with your IBD patients, your ulcerative colitis, your Crohn's patients. So more common in those patient populations. Thrush. So again, I mentioned this. Thrush is when we see that white coating, we typically think of it in the mouth. On the tongue, we think more, but it could also be on the cheeks, the throat, and the roof of the mouth, making sure we're looking really good and doing an exam in the mouth to see if that's present. And often the patient's going to report that to you anyway, that they found that. And that's termed just oral candidiasis. They could also be having some frequent skin infections or nail infections. So Candida normally lives, like I said, on the surface of the skin. But sometimes these yeast can make their way beneath the surface of the skin or even the nail, and again, causing infections. Candida really loves this warm, moist environment. And so these infections on the skin typically occur in like skin folds. So think things like armpits, groin, even under the breast. You can also see it sometimes on the torso, and that's just called cutaneous candidiasis. And then if you see that in the nails, that's called candidal onychomycosis. And so that's just, again, when Candida infects the nail bed. Also, think about frequent UTIs. Now, we know that UTIs are most commonly caused by bacteria, right? I think 80 to 85% it's estimated of UTIs are caused by E. coli. But you can also get Candida albicans overgrowth in the urinary tract. And so you can have a UTI that's actually caused by Candida. So just doing a simple urinalysis is going to tell you, is it perhaps Candida, or is it another bacteria like E. coli? Some additional signs and symptoms that we typically see are going to be things like brain fog, especially. So, again, Candida can damage the gut lining. I mentioned increased intestinal permeability already. When we have this increased intestinal permeability, what happens is these toxins that are released by Candida, things like acetaldehyde, uric acid, these toxins that are released actually leave the gut. They make their way into the bloodstream, around the body, and that's typically what causes the brain fog. Brain fog is very common in patients with Candida. Intense sugar cravings. Again, sugar feeds Candida. So you're going to see often they're going to report that they just have these intense sugar cravings that they really feel like they can't control. Fatigue is another one. A lot of times that's from just that, again, those circulating toxins in the body. And then joint pain, typically going to be from inflammation, but I do see often a lot of joint pain in patients with Candida. And then less common, you're going to see invasive candidiasis. So this is really like a more serious infection. typically occurs when Candida enters the bloodstream and then it spreads to our organs. Now, this is going to be more in people who have those weakened immune systems, like people who are maybe undergoing chemo, also your organ transplant population, you might see that in. And then just in the inpatient setting, sometimes we see that when patients have different catheters in, whether it's some type of like central venous catheter or a Foley catheter, you can get candidas forming on those catheters. And so then they can become infected that way. Now, there is something called small intestinal fungal overgrowth. So you're probably, again, more familiar with SIBO, small intestinal bacterial overgrowth, but there's also something, if you've never heard of it, called SIFO, small intestinal fungal overgrowth. So that just occurs when we have this excess amount of yeast growing in the small intestine. Remember that it's normal to have some, but we don't want this to proliferate and get out of control and really overgrow. And that's what SIFO is. So this overgrowth tends to cause a lot of these symptoms that we talked about: abdominal pain, significant bloating, gas, belching. Often with this, you're going to see more diarrhea, maybe even some nausea. And there's actually a lot of kind of growing evidence that fungal overgrowth in non-immunocompromised patients can be causing a lot of the symptoms that we're seeing in practice. This, again, bloating, gas, belching, diarrhea, things like that. And so this article that I've referenced here um, it looks at two things that, or a couple of things actually, that predispose patients to SIFO. So the things that they have found predisposing patients are small intestinal dysmotility. Basically, the small intestine is not moving contents through as readily as it should, and it's really allowing the right environment for Candida to become overgrown. Now, that could be caused from neurological disorders like Parkinson's, multiple sclerosis, even diabetics who have neuropathy could have this small intestinal dysmotility that could then allow the Candida or the fungus to overgrow. You can also have things like connective tissue disorders like scleroderma, medications like opioids that slow motility, autoimmune disorders, and then some cases of this they found just to be idiopathic. And then the other thing too that this study references is chronic proton pump inhibitor use. So when we're using PPIs and we're creating this lower acid environment, when we have hypochlorhydria, that really just creates the right environment for things to get overgrown. Not just yeast, but bacteria as well, of course, but certainly for yeast to get overgrown. Remember that our stomach acid is antimicrobial, right? So it's like a protective thing that we have to prevent overgrowth. But then also our food doesn't digest as readily. So motility and things are slower moving through the digestive tract, including the small intestine. So then we can get this overgrowth. Okay, so now let's say you're working with a patient, you're suspecting, they're telling you all of these things, a lot of these symptoms we talked about, and you're suspecting maybe they have some Candida overgrowth. So now you want to get to the root cause of it, and you're wondering, what lab should I actually order to do that? And so I'm going to highlight just a couple of labs here that you should consider in your patients that you suspect Candida. So a comprehensive stool test is going to be really important and probably really top on your list. A comprehensive stool test is going to not only evaluate, is there Candida? So many of the stool tests look at not only Candida species, but then specifically Candida albicans. So that's generally the strain that we see more often. But then the great thing about looking at or ordering a comprehensive stool test and looking at the results is you're going to be able to assess for dysbiosis. So remember, dysbiosis is a very common cause of Candida overgrowth. So, is there dysbiosis present? And we're going to know that by looking for opportunistic overgrowth, pathogens being overgrown, and then also looking at the commensals. Maybe the commensals are insufficient. They could also even be overgrown. But we also, in a comprehensive stool test, are going to be able to look at inflammatory biomarkers. We're going to be able to look at immune biomarkers. So this really just helps you put the whole picture together and determine, okay, maybe they have candida. Okay, we want to target that. We want to work on that. But then you're also going to be looking at, is there a lot of inflammation? Okay, we need to be working on inflammation. Is there perhaps increased intestinal permeability? Could be another area of focus. And then what does their immune system look like? Do they need some immune support? So those are some of the things and added information that you'll get with a comprehensive stool test. You can also see, I just want to mention this because there's not a test. I'll often get asked this. There's not on comprehensive stool testing a specific biomarker for hypochlorhydria. However, there are certain patterns that we see that indicate or that we call a hypochlorhydria pattern. So this would be things like commensal overgrowth, opportunistic overgrowth. You might also see that the steatocrit, which is a marker of how well you're digesting and absorbing fat, that might be elevated. You also might see an elastase level, which is one of the pancreatic enzymes, that may be low. So that all of that sort of paints a picture of hypochlorhydria. And again, remember, that's a very common reason that yeast and other pathogens get overgrown is from not having enough stomach acid. And so I've highlighted here two comprehensive stool tests. There are others, and I would encourage you, if you've never done this and you don't know about this really cool tool that Rupa has, when you're in your Rupa dashboard, you can go and you can do a lab comparison. So you could look at all of the comprehensive stool tests. You're going to get tons of information in terms of what biomarkers each test looks at. It's going to break down what's the cost, what type of collection is it? Obviously, this is stool, but you can do this with any test. It's going to give you patient instructions. It's going to give you what a sample test looks like. Just really anything you would want to know in comparing different tests. The GI map is one by Diagnostic Solutions Lab. GI Effects is another popular comprehensive stool test by Genova. And again, there are others, but I would encourage you, if you haven't done that, if you're looking to, maybe you don't already order comprehensive stool testing and you wonder what's the best test, what are the benefits to one over another one, go in there and use that lab comparison tool. It saves you tons of time and is a really cool feature. Okay, next up, SIBO breath testing. Now, why SIBO breath testing? Again, SIBO commonly occurs with Candida overgrowth. So this might be another test that you want to order for your patient. But SIBO breath testing, it measures the presence of hydrogen or methane in the breath after the patient consumes a sugar solution. It could be lactose or glucose based on the specific test that you order. And so the idea with this is that this overgrown bacteria in the small intestines will ferment this sugar that's been ingested, and then it will produce gases. And so when those gases, whether it's hydrogen or methane, that's going to depend on which bacteria are overgrown. When they're absorbed into the bloodstream and then expelled through the lungs, it's detected in the breath. And so that's essentially what a SIBO breath test is looking at. And so these are two just examples of SIBO breath tests. There's one by Genova, and then there's one called Trio Smart by Gemelli Biotech. They test hydrogen methane and hydrogen sulfide. So those are just some options for you. Then you can order all of these in your Rupa dashboard. And then in terms of a blood test, there are actually some blood tests that you can order for Candida. A Candida profile, and you can see I have an example here. There's one by Alitest, but a Candida profile is another way to look for Candida overgrowth. And what we're testing here is we're looking at these immunoglobulins. So we're looking for antibody reaction to the yeast, Ig, IgA, IgM. This way of testing, I would say, is not as inclusive as a comprehensive stool test because, again, you're going to get so many more biomarkers and just a lot more information. But you can, again, order a blood test. It can be, and you could do this alongside a comprehensive stool test, a SIBO breath test, and maybe even a food sensitivity test. But again, Ali test, this is an example. They also give you a Candida immune complex marker in that profile. And then Urine. You can actually do a urine at-home test that it looks at the DNA of Candida, and an example of that is this Candida panel by Real Time Labs. Okay, so now we have maybe ordered tests, maybe we've confirmed the patient does have Candida. And so now we're going to talk about what are some treatment options. I am going to briefly mention conventional treatment, but then we're going to go deeper into natural treatment options. So, for your conventional treatment, the most common pharmaceutical options you're going to see are these azole antifungals, right? They end in azole. So, it's things like fluconazole, itraconazole. And these work by inhibiting the cytochrome P450 enzyme that they also inhibit the growth of the actual yeast. They punch holes in the cell membrane, and then that causes the cell to become more permeable and to die, basically. You can also add other medications that sort of increase the efficacy of these, things like amphotericin B. There are other options as well. But I would caution you and just want to point out that there is actually a big instance of antimicrobial resistance. It's a real issue. And this is an article coming from the CDC stating that antimicrobial resistance is an increasing problem with Candida, and about 7% of blood samples tested at the CDC are resistant to fluconazole. And that's probably the most common antifungal that we see used. But often the strains that we're seeing are resistant. So, this is where you, as a root cause practitioner, really can have a huge impact in working with your patients using more of a natural approach that not only is effective, I'm actually going to show you some of the research and literature on this, but not only is effective, but doesn't have all of the side effects, right, that come along with some of the pharmaceuticals that we use. So, some natural support options. This is a list of them. I'm going to go into detail here in just a minute, but some of the things that you're going to want to consider when you're treating Candida: caprylic acid, oregano and thyme, garlic, berberine, mint, basil, lavender, tea tree, winter savory. All of those are essential oils, grapefruit seed extract, and probiotics. Okay, so this first study here, this looked at caprylic acid and both carvacrol, it's basically just a monoterpenoid compound that's found in oregano and thyme oil, and also thyme oil, which is again a monoterpenoid compound that's found in thyme. And so what they found is combining these together in patients with Candida had this synergistic effect. And these could be used to inhibit the growth and to treat patients with candidiasis. This study looked at garlic. You may know that garlic actually has a lot of antimicrobial properties. In this article, if you wanted to go back and look at this article, it not only talks about the antifungal properties, it talks about antibacterial properties, antiviral properties, lots of good properties that garlic has. And you may hear this referred to sometimes or referenced as garlic allicin. Allicin is basically the compound in fresh garlic. It's actually released if you had a fresh garlic clove and you crushed it, you chopped it, you chewed it. Allicin is actually what is released, and that is what has the most benefit here. Allicin, however, is highly unstable and it can degrade very quickly. If it's fresh garlic, it needs to be consumed pretty quickly. And then you also, if you're using it in a supplement, then you want to make sure, of course, that it's a good, high quality, stable supplement so that you're getting the most benefit from that. But again, this article here looks specifically at all of the benefits of garlic, including the antifungal properties. And so there are many different strains of yeast that are actually sensitive to garlic, including Candida, and the adhesion of Candida can be reduced by using garlic as like a support or treatment option. So this could be dietary additive or it could be in supplemental form, but very supportive in Candida overgrowth. Okay, berberine. So berberine, pretty popular supplement. You may know that berberine has a lot of antimicrobial properties. Berberine also is great for good glucose control. It's great for lipids. It's great for metabolic health. So, when we're prescribing supplements or when we're recommending supplements to patients, we always want to look at sort of the overall picture. So, berberine can be really helpful for lots of other things. So if you have, let's say, a comprehensive stool test, you may find other things on the test, not just candida, that berberine could be supportive for. So this could be based on what else you find on the test. This could be a really, really good option. But this study that I'm showing you here, that I have referenced here, examined berberine's effects on specifically Candida albicans, and found, and it was actually Candida albicans that was resistant to fluconazole, to that most popular pharmaceutical that we see used, and found that berberine had antifungal activity against those fluconazole resistant strains. So great option. Again, remember there's a lot of resistance. We just want to use as many natural options as we can, especially in the face of resistance. And then essential oils. There's actually a lot of studies using essential oils, not only for candida, but for many of the pathogens that we look at targeting. But this particular study looked at mint, basil, lavender, tea tree, winter savory, and oregano. And what they did was they compared the antifungal activity of some of the standard medications that we use. In this study, they specifically used or looked at clotrimazole, fluconazole, and itraconazole. And so what they found in the comparison is that the results showed that damage to the cell wall and the membrane of the yeast was stronger with essential oils than it was with conventional pharmaceuticals. And so I think that's pretty powerful. They were actually more effective than those pharmaceuticals. And then another option for you, another natural option is grapefruit seed extract. So this study here that I've referenced focused on oral candida infection. So this was really looking at candida overgrowth in the oral microbiome. And in looking at that and the antifungal properties of this grapefruit seed extract against many strains of candida, including Candida albicans, and they found it to be very effective with no side effects. And again, I think that's one of the biggest issues is we have to think about conventional versus a natural approach. We have to think about what are all of the side effects to some of the conventional treatments. Oh, I think I have frozen myself because I talk too much with my hands. So let me there. Sorry about that, guys. Next up, so probiotics. We know that probiotics have repeatedly been shown to be beneficial to help reduce candidal infections. But using that comprehensive stool test that we talked about previously can also help you customize maybe where some deficiencies are, and what probiotics you might want to choose for your particular patient. But we know that probiotics are helpful, but there's one specific probiotic that we do often use more in patients with candida, and that is Saccharomyces boulardii. And that's what this article is looking at. It looked at this popular yeast-based probiotic, which again, Saccharomyces boulardii, and found it to inhibit growth as well as adhesion and biofilm formation, which we know can happen often in candida. And it's from the capric acid that's secreted by S. boulardii, and that's different than caprylic acid. So S. boulardii secretes this capric acid, and that is what helped to inhibit growth and adhesion and biofilm formation. So this would be a great choice in your candida patients. Okay, now finally, I'm going to wrap up with some dietary consideration. So there is something called the Candida diet. And so I'm going to show you what are some foods on that diet, foods we want to incorporate, foods we want to eliminate. But basically, this diet is low in sugar. It's anti-inflammatory. It focuses more on these non-starchy vegetables. Not that we're not going no carb here, right? We're just looking for lower carb, lower starchy vegetables, lower sugar fruits, and just healthy sources of carbs and complex carbs, right? Also, eliminating gluten. So you can have grains, but the non-glutinous type grains. It encourages fermented foods and also, of course, healthy protein. Now, it's designed to support the immune system, to stabilize and balance blood sugar levels, and really to help diminish yeast or Candida overgrowth and bring the gut microbiome back into balance. And I think sometimes we can develop some tunnel vision and start just looking at supplements. Oh, this patient has Candida. What do I need to give them? And sometimes we forget about how really powerful diet can be and just those foundational things that we always really need to be discussing with patients and reminding them of. On this diet, these are just, you could give this, you could take a screenshot of this, you could print it, you could give it or send it to your patients. But this is basically the list of foods that we want to incorporate. Again, non-starchy vegetables, low sugar fruits, alternative sweeteners like monk fruit and stevia, and then foods that we want to really avoid. I would say what I see most commonly people struggle with is eliminating sugar, of course, because many people are addicted to sugar, but also alcohol is another one. And I'll often have patients say, so I can't have any alcohol at all. And so I typically try and explain to them that sugar, alcohol feeds candida. Nobody's perfect. We're all human. So we want to be as restrictive as we can to get best results. But I think the minute you tell someone they can't have something, then that's what they're going to want more of. So I think just supporting them and letting them know that this is going to give you the best chance at healing and getting rid of the candida, but we're all human and do the best you can, kind of thing. So, how long should you stay on a candida diet? As you can see, this is a healthy way of eating, right? It's anti inflammatory. It's something that a patient could stay on long term. Some people are going to see results faster than others. Some people are going to see results in a matter of a few weeks, especially if it's somebody eating like the standard American diet, right? They start to make some of these changes and they're probably going to feel better and see results pretty quickly. Other people, it may take a little bit longer. And I would say if you're working with someone, you're giving them these guidelines and they seem overwhelmed, it seems maybe too restrictive. If we try and do too many things at once, then often the patient just doesn't stick with anything. So usually I just say, if that's the case, let's start with one thing. Let's start with working on cutting back on sugar. Let's start with using some sugar alternatives, or maybe if it's alcohol for them, let's start working on cutting back on the alcohol and then move on to the next step. Maybe next is working on eliminating gluten. But I think taking more of a stepwise approach like that can be really helpful and less overwhelming for patients and things that they can actually stick to and really start to see some good results. Okay, retesting and follow up. So, when should you retest your patients that you found candida? You've given them a protocol. So, for your comprehensive stool testing, you'll want to repeat that about 4 to 6 weeks after the protocol is complete. So, you want to make sure the patient's off all antimicrobials pretty much for that length of time, 4 to 6 weeks, to really get a good idea of, is there still some lingering candida? Is it starting to overgrow again? So, you'll want to wait that length of time. For blood and urine tests, you could reevaluate in 6 to 8 weeks to see if maybe any modifications need to be made to your treatment. But generally, that's like a general guideline. Excuse me. And before I'm going to take a quick look at the Q&A. I just wanted to let you know about this newer program that we have. We started in January with our mentorship programs. If you are someone who is looking for more support around gut health, you're looking to collaborate with colleagues, this is the right place for you. Inside this mentorship, we have weekly live Q&A. So you get an hour of Q&A each week. We do things like talk about cases. We may have a practitioner who brings a case, wants help looking through that, creating a protocol. It may be questions related to business and building your business. It's a great way to collaborate with colleagues. And one of the reasons that we created this mentorship is because we were hearing from a lot of practitioners, probably just like you, that it's really lonely to be out in practice. I don't have other colleagues that I can collaborate with. And so we wanted to keep these groups small, bring practitioners together, give you some good guidance around this particular mentorship is obviously around gut health. but also connect you with your peers and with your colleagues. If you're interested in this, if I know Lexi will drop the link in the chat for us, you can take another look at that on the website. We do discovery calls every Tuesday, so you can sign up for a discovery call, and I'd be happy to answer any questions on those discovery calls. Now, just quickly, let me look. I think I have time maybe for a couple of questions before I turn it over to Sophia. And sorry, I have frozen myself again. All right, let me just look at the Q&A. Let's see. Would SIFO show up on a SIBO breath test? So that's a great question. So likely, no, that's not going to show up. And here's why. It's a different metabolic process. So these breath tests are designed to detect gases that basically are specifically produced by bacterial fermentation, right? And so yeast, like Candida, metabolizes sugars a little bit differently, and they typically don't produce hydrogen or methane. So that's not going to show up on a SIBO breath test necessarily, but that's a great question. Okay, how long should you treat Candida with natural products? So generally, I find that you need about 60 days. So I'll generally do a 60-day protocol. And then at that point, you can see how's the patient doing. I have done 90-day protocols for somebody with really high levels with lots of symptoms, but generally 60 days is often effective. Let's see. If someone has leaky gut caused by Candida, how long does it take to heal? So leaky gut in general, like literature shows that it can take 6 up to 18 months to heal leaky gut. So there may be a few supplements that you want to keep the patient on, things like glutamine, collagen, omegas, things that are supportive for healing leaky gut. And then let's see, when you're treating with natural options, do you just choose one option? So what I found with natural options is you generally will need to choose 2 to 3 options. If you're choosing something like caprylic acid and oregano, you might also want to add some berberine or some garlic. And that this is really, again, where your comprehensive stool testing comes in to be really useful, because if there are other things that maybe garlic is supportive for or oregano is supportive for on your test, you're going to be able to target those things too with one supplement.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.